Hello, I am Dr. Harsh Ajay Suri, Consultant ENT and Head and Neck Surgical Oncologist at River Hospitals, Nalgonda. Today, we are going to talk about one of the most common ENT conditions, which is called as Adenotonsilitis. Now, this Adenotonsilitis is an infection. Andarki everkaina ravachu, but pillalki chala common. Tonsils normally andarki untai, but tonsillar infection vaste adi daniki tonsillitis ani antaru. సో కామన్లీ సిమ్టమ్స్ ఏముంటుంది టాన్సిలైటిస్లో మనకి గొంతుల నొప్పి, జ్వరం రావడం, మింగడానికి కష్టం, చెవి నొప్పి, నెక్ స్వెల్లింగ్, lymphadenode. So the most common ENT conditions is adenotonsilitis. Now this can be seen at any age, but commonly we see it in pediatric population, that is young children. Now what is tonsillitis? Tonsillitis is the inflammation or infection of the tonsils. Now the symptoms which the patient may present with is painful swallowing or throat pain is the most common feature. Along with that, fever is another common complaint that the patients come with. Ear pain, difficulty in swallowing, and lymph node enlargements or swelling in the neck are the other common features. If it progresses to stage 4, then the patient might also have difficulty in sleep and choking sensations in sleep. Now, the other common thing that we encounter in pediatric population or the young kids, it might start as soon as 2 years of age, but also can progress up to 20 years. This is adenoids, and the infection of adenoids is called as adenoiditis. Now, what are the symptoms that we encounter with adenoid hypertrophy? These are difficulty in breathing, nasal block on one side or on both the sides. Patients might have a lot of snoring issues at night. They might have difficulty in sleeping because of snoring and choking spells. In children, if it starts at an early age, they have lack of concentration in schools. They have decreased studying and concentration in school, which is a common feature. Now, for these complaints, you should definitely visit a nearest ENT surgeon so that you can be treated. Now, both these conditions can be treated both medically and surgically. So when do you have to come and visit your doctor? You have to visit your doctor in cases of acute infections. That means when you have common features, complaints such as fever, throat pain, nasal discharge or cold, with difficulty in breathing and snoring, you should immediately consult your local physician or ENT surgeon at the nearest hospital. Now, what is a permanent solution for these conditions? The permanent solution is surgical. Now, we don't have to worry. There are various misconceptions about the complications regarding the surgery and the fear regarding the surgery. But I can assure you that the surgical management or the surgical treatment for chronic adenotonsilitis is very, very simple. Now, when do we get the treatment done? We get those things done when we have difficulty in normal day-to-day life because of these symptoms. If the child is not able to gain weight, if the child is having constant pain in the throat, if the child development is delayed, if the child is not increasing in height or having difficulty in sleep, you have to consult your ENT surgeon. So it requires a lot of lifestyle modifications, which is difficult. So at a younger age, if the child has to stop drinking cold water or ice creams or chocolates for that matter, that will cause a lot of problems. That requires lifestyle changes, and that is when you should consult your ENT surgeon for tonsillectomy and adenoidectomy. We have various methods of doing adenotonsillectomy, which includes conventional method by cold steel instruments, microdebrider, coblator and laser. And I assure you all these options are safe, painless, and patients are able to go back to the normal lifestyle within 1 week of surgery. So what are the precautions that we take for patients who have chronic adenotonsilitis? The common precautions that we have to take is the lifestyle modifications. Ante, you are requested not to have cold water, cold juices, cold drinks or ice cream. This is the major lifestyle change that patients with chronic infections have to undergo. Apart from that, you are requested to wear mask at all the time, especially in school going children if the children are also infected, so that you don't infect the other children and you don't carry other more infections from the school. You should also avoid spicy food or oily food or fried food items. because these can cause increase in the throat pain. You should also encourage children to drink boiled water at home. Now I understand this is summer season, and in summers the infections are usually less, but such precautions in children who have chronic tonsillitis since many years together, you should take all your precautions. And the best time to get surgery done is also during the summer vacations, because the child can enjoy all the summer vacations by having all cold drinks, ice creams and chocolates. So this is the best time to undergo surgery for it.